So Mike Levere is here from Colgate, presenting some work with some of his former colleagues at Mathematica. And so we're gonna go till 1:30, and actually encouraging questions throughout, so please don't be shy. With that, hand it over.
Yeah, so thank you so much for coming and for having me. It's been great to be here. And yeah, so I'm looking forward to telling you a bit about this program called Promise, which trying to help kids with disabilities as they're transitioning into adulthood. So just as kind of a bit of basic motivation, I think we have a lot of really good research in economics that shows that the safety net is really successful at helping kids over the long term. And it's really in some ways most effective when these investments are made in kids. So there's been a lot of research on Medicaid, like the establishment of Medicaid in the 60s, when it had all of these expansions in the 80s, that show that kids who get Medicaid coverage end up, in adulthood having better employment outcomes, lower disability benefits, better health, all of these sorts of things. And so by, providing these safety net dollars, we help improve their lives. Similar with the earned income tax credit, there's a great paper showing that like the kids who qualify, if they're born, December 30th, so when they get their parents get the first EITC payment in April, like when they're 4 months old, those kids go on to earn more when they're 26 or 27 than kids who are born January 1st, January 2nd, who parents don't get a payment until they're 16 months old. And so, right, that helping these kids earlier in life makes a difference. Same is true with, the establishment of the food stamp program, with housing vouchers, the Moving to Opportunity experiment, as well as like the establishment of Head Start. And so all of these things show, right, safety net is really good and it helps improve long-term outcomes for kids. And these are some of like the highest marginal value public funds is when we invest in these low-income households. But despite that being the case, we don't have the same evidence for kids with disabilities. And so kind of the big source of means-tested support that is offered to kids with disabilities is the Supplemental Security Income program, or SSI. And so I have a paper this was like my original job market paper when I finished my PhD many years ago, that actually shows that people who qualify for SSI benefits in childhood end up doing a little bit worse in the labor market when they reach adulthood. And then there's a more recent paper that uses another regression discontinuity approach, looking at people who just qualify for SSI as a result of their kid being below the low birth weight threshold, looks at them over the course of their life, compares to someone who was born just above that threshold and didn't automatically qualify for SSI, and their outcomes are essentially identical. Giving these additional sources of support don't actually improve outcomes in the way that they did for all those other programs that I mentioned on the last slide. And so what has been hypothesized is basically this double disadvantage of both being born in poverty and having a significant disability may be really hard to overcome. And what that motivates is this question of what else can we then do that might help to improve outcomes for these really disadvantaged kids with disabilities? And that's what I'm going to tell you about today. So what we're going to do in this paper is look at Promise. It's the name of the program. It was called the Promoting Readiness of Minors in SSI. And this was a program that was implemented across 11 states. There were 12,000 child SSI recipients ages 14 to 16 who enrolled in the program. The Social Security Administration did this large randomized controlled trial. And then working with my colleagues at Mathematica, evaluated it to see what the impacts are. And what Promise did is it offered this set of services to youth and their families. And so, briefly, this included things like case management to help them navigate kind of all the aspects of, their kid's disability and what's going to happen as they're getting ready to transition into adulthood, benefits counseling, trying to educate them about how you earn certain amounts, how that's going to affect your benefits down the road. And I'll tell you a little more about that. And what it does, it supplements the existing cash benefits that these families get through SSI, these monthly cash payments. And what it also did is it tried to improve service coordination to help youth, access a more, interconnected set of services and supports. So that way they're not having to navigate a more complicated and fragmented system. And to evaluate this, we're going to draw on a lot of administrative and survey data to study these kids up to 5 years later. So they'll be 19 to 21 when we're following up with them. So we're going to have administrative data from the Social Security Administration to look at their participation in SSI. We have data on their Medicaid expenditures from the Center for Medicare and Medicaid Services. And then we have their annual calendar year earnings from the IRS. And then we also did 2 surveys, one 18 months after they originally enrolled in the program and one 5 years after they enrolled in the program, that will help us get, a more rich set of measures around what they their participation in the services that were offered, as well as more on their, more in depth on their employment outcomes, especially later down the road. And so just to give you a sense of what we find is that first, we offered these additional services. We see that that does in fact lead them to take up more services. So there's a big increase in this. There are, kids in the control group already access a large range of services, but there's a really big increase in take up of services for kids if they're assigned to the treatment group. Down the road, we then see that there's an increase in their employment and their earnings, roughly 7% of both. But it's important to note that those impacts faded over time. I'll show you, there was a big increase right at the beginning, kind of when maybe that employment was a result of the program itself, that they were given, paid jobs. And then as time went on, those jobs maybe went away, kids in the control group started becoming, more likely to be employed themselves. These impacts faded, but even 5 years out, we do see an impact. There's a reduction in healthcare expenditures. So I'll show you that, there's no difference in terms of whether these kids are enrolled in Medicaid or not. So they're still basically all enrolled in Medicaid, but then we see less expenditures on Medicaid. And so I'm going to be a little cautious and not quite say that that's kind of an improvement in health, but it could be consistent with an improvement in health, that they're kind of using healthcare less. And then what we're going to do is try to disentangle what drove these effects. So we see this increase in employment, we see the reduction in healthcare expenditures. What was the driver of that? Because there was this wide range of services. We're going to do a mediation analysis to try to tease out which of these services were more and less important, actually leading to the impacts that we found. And the thing that really stands out is this youth early paid employment experience, that by putting kids into jobs, that helps them to, presumably develop human capital and then continue to be in jobs down the road. But then the really important caveat here is that, we do see this improvement in impacts, and that's really important given how hard it has been to move impacts for this population, but it was really costly to do so. And so if you try to quantify what are the costs and benefits, I'll show you that there's a really big negative net benefit or big cost. But the key caveat there is that all of the costs have been incurred at this point. So the costs are kind of over the first 5 years, it was implementing the program, offering these services. In theory, the benefits will continue to accrue over the course of these kids' lives, and we're only observing them for 5 years. So, the jury is in some sense still out, but there is, at least for now, a big negative net benefit. Yeah.
Just to clarify, is it like the first 5 years post participation?
Yeah, so it's 5 years after they first enrolled in the program. So they're going to be ages 19 to 20. They enroll at 14 to 16. Now that we're looking at when they're ages 19 to 21. So some of those 5 years are years that the intervention is ongoing. It's not like 5 years after the end of the intervention. It's 5 years after they enroll. All right, so let me tell you a bit more about, so that's kind of the quick 10-minute overview. So SSI, just as a quick overview, it's the largest cash welfare program in the US. It pays about $50 billion annually to the elderly and people with disabilities. We're focused specifically on kids who qualify for SSI benefits. And in order to qualify, they have to meet two criteria. First, they have to have sufficiently limited assets and earnings. This is a means tested program. So earnings need to be low, and there's a $2,000 resource limit for individuals. So these are very low income, low resource, kids coming from low income and low resource families. Yeah.
Clarify, that's the resource limit for the children's parents.
Yeah, so it's a little, the resource limit is $2,000 for an individual, but the $2,000 is based on what the parents have. I believe, and I can be corrected if I'm wrong, that it ends up, there's like an exemption, so it really ends up being like a $4,000 resource limit for the parent, because only a share of their assets are deemed onto the kid, but it's still very low resources.
An exemption for a primary house.
Yes, so if you own a home, if a car is used for like transportation to a job, but those are kind of the two big exemptions. You know, there's like a few other things as well. Nowadays, there's an exemption for like if you have money in an ABLE account, that is exempt from this up to $100,000 there. But yeah, very, very low income, low resource families. So, right, that's based on how much the parent has. It's based on deeming of the parent's earnings onto the child. And then in addition to that, you have to have a disability. And the definition of disability for kids is based on having what's called a marked and severe functional limitation. For adults, the analogous definition is about having an inability to perform substantial gainful activity, which means that you can't work. So to some extent, we can think of this as just like, you know, being sufficiently limited that I'm not able to really succeed in school. But there, you know, this is the technical definition here, and it's based on across a wide range of like activity and function domains. Do you have sufficient limitations? And if you meet these two criteria, you apply for benefits, you get SSI, your family will get a monthly cash payment of up to $967. And then typically you automatically are enrolled into Medicaid coverage. You know, it's not true in every state, but most of the time, almost all of these kids have Medicaid coverage. And so our study is looking at kids who are 14 to 16, and so they're getting ready to approach adulthood. And so I think it's really important to think about what does the transition to adulthood typically look like for these child SSI recipients. And what happens is that all youth, as they approach age 18, have to undergo a redetermination to see if they still meet the adult disability standard, which, as I mentioned, is about your ability to work and an ability to perform substantial gainful activity as compared to this like marked and severe functional limitation. And so what happens is that about half of kids end up losing their benefits at age 18. And there's been some really great research on this. So Manasi Deshpande has a great paper showing that these families rarely plan for the possibility of losing benefits. Like if you ask them, what do you think the likelihood is that your child is going to lose benefits at age 18? Pretty much all of the parents say there's a 0% chance, when in fact, you know, there's in fact half of kids are going to lose benefits, and there is a, you know, distribution there, but it's much higher than zero. And what we know then from some of her other work is that people who lose benefits at age 18 end up having much worse they have very bad outcomes in terms of the labor market and in terms of the criminal justice system. So, you know, if you lose benefits, you do actually go on to earn some more money than if you don't, but it's not nearly enough to make up for the loss in benefits. And so arguably as a result, kids often turn to kind of income generating criminal activity and are much more likely to be arrested, much more likely to be incarcerated if they've lost their SSI at age 18. In addition to that, the support system for people with disabilities to access becomes more fragmented. So when, as a child, most of the services that people get have been through schools, so special education and the Individuals with Disabilities Education Act. Whereas then once you're out of school, there's a much wider range of supports through things like vocational rehabilitation. There's centers for independent living. You know, some people get supports and services through Medicaid. That makes it trickier to navigate this whole system. So into this and what was established is Promise. And this was created by the Social Security Administration, the Department of Education, with a goal of helping to prepare youth as they're going to transition into adulthood. So that way they can successfully, become established in jobs and have better labor market outcomes and become less reliant potentially on disability benefits. So what this did, the Promise Initiative required 5 key services. So first you have case management that's helping people navigate this broader service delivery plan for what's going to happen as they exit school and transition into adulthood. Then you've got benefits counseling to help understand what are the program rules that are going to connect your earnings to your benefit payments. There's financial education, which is designed to promote financial stability, career and work-based learning experiences, in some instances getting youth internships, sometimes placing them into paid jobs. And finally, there was parent training and information, which was trying to help parents better understand their role in helping the youth to ultimately achieve, what the goals are. And so, as I mentioned, this was implemented across 11 states. There are 12,000 child SSI recipients that enrolled in the program. And yeah.
So are the first 4 focused on the youth and the kids? Like it's case management for the youth, not case management for the parent?
So there's some of this that's actually for both. So there's a range. The one thing about Promise, and I'm simplifying a little bit here, it was really designed both to offer services to the youth and to the families. And so in some instances there were employment promoting services offered to families as well, because the theory was that by helping the family achieve a more stable situation, that could kind of trickle down onto the child as well. We're really focused here. There's not a ton of evidence that those family-oriented services did much, so we're focused on what the kid experience was in the kid services. And so even the parent, you can think about some of the family-oriented services as being oriented toward the kid, like parent training and information, but an employment service that's trying to help the parent get more employment is really oriented towards the parent. So we're focusing on the stuff that's oriented towards the kids. And the other thing I should say is that, this is across 11 states. I'm mentioning these 5 services, but the way that this was designed was actually as 6 separate RCTs almost. But we're ultimately, and so one of them, Wisconsin, had its own Promise program. And so the way that each of these programs implemented this key set of services could have differed, and in some cases it did differ, but they all had to offer these 5 main services. And so we ultimately are going to kind of pool everything together because 1, it's the same core set of services, and 2, and we end up finding you get more power when you have 12,000 people in regression instead of 6 2,000 person regressions. And we also, when we did kind of a heterogeneity analysis to look at, did the impacts differ by program? They didn't. And so we get a little bit more power by being able to say, look, in only a couple of these programs did we see significant impacts, but some of the ones where it was a positive impact but not significant, by pooling it together, there's a more consistent story that we can tell that they improved employment in some ways. So that's kind of the overview of Promise. Any questions on that? Yeah.
On the last slide, you said about 50% of children's. Thank you. Do you have a breakdown of how many of that is people who are just unaware that it's going to lapse and I lost the benefits versus not eligible or all the
Yeah. I don't. I think. Right. So I think what you're kind of getting at is, in some instances, people, say the Social Security Administration asks you to provide information and you just don't do it, then you're going to lose benefits. I don't think that's a particularly high percentage of this. There are some differences, in terms of what type of disability you have. So kids who have mental disorders are more likely to lose their benefits at the age 18 redetermination. That's also the vast majority of kids on SSI. I don't have that number off the top of my head, though.
Will you answer my question? Thank you.
So here are kind of the 6 programs that you can see in kind of 11 states, because one of these programs was a agglomeration of 6 different Midwestern states. And so you can see that this was all, like, the timing of this was a little bit different, but for the most part, you know, this enrollment started in April of 2014. A few states started a little bit later, and enrollment was done by April of 2016. You know, Wisconsin's program ended, I think, in September of 2018, but some of these programs went on into 2019. But so by the time that we're looking at people's, you know, outcomes, at least especially in that 5th year, all of these, the programs are done. So like, we're not, by 5 years out, right? If you're somebody who enrolled at the beginning, you're basically, we're not capturing people who are still getting these services down the road, because the programs are done. You know, people who enrolled later, that's especially, you know, more true for, and there's more enrollment a little bit later in the enrollment. But just a little sense of the timing when this is happening, we're then gonna be looking at data that's going through 2020 and 2021.
Yeah. Is there heterogeneity in the amount of time that people got services based on when they were enrolled? Services given for a fixed amount of?
Yeah, there is some heterogeneity in that if you enrolled earlier, you potentially had the services for longer. Okay, so let me tell you a little about the data and our empirical strategy. So from the data side, our administrative data we have from Social Security Administration, we have their disability program participation. So we're going to look at SSI and SSDI. Almost all of this is driven by SSI. And so we're going to look, you know, in the year before the earliest person enrolled, so April 2013, up until at least 5 years after the last person could have enrolled. So the last enrollments were April of 2016. So we'll look through April of 2021. For CMS, we're looking at their Medicaid and Medicare enrollment, and then the expenditures that were occurring in that program. Same time period, year before enrollment to up at least 5 years after enrollment. But here, even though, right, kind of to your earlier question, we have, you know, we have kids getting the services for different periods of time. We're still gonna look for everybody, what happened 5 years after they first enrolled. And so then for the IRS, we have their annual earnings going from 2013 up through 2021. So that's just calendar year. This is what we have available. So for the surveys, we then did these 2 surveys. One was 18 months after they enrolled, and the other was 5 years after they enrolled. So 18 months out, we were primarily interested in their use of services. So like we asked them about, you know, did you use benefits counseling? Did you use, you know, did you get financial education services? What were the different things that you got? As well as we got some short-term outcomes, like if youth had a paid job. And then 5 years down the road, we're going to look at more detailed employment and earnings data in particular. And there's a whole bunch of other outcomes in this. So we're also asking about education and a wide range of things, but we're going to really focus for the purpose of this paper on kind of the employment story. We were, you know, very fortunate with Mathematica kind of ran the survey, and they got very, very high response rates. So, you know, over 80% responded to both of these surveys. It was similar in the treatment and the control groups. You know, technically there's a very small difference of like 1 percentage point, but not something that, you know, we're super worried about, like differential response rates. And so when we do analysis with the survey data, we're going to use survey non-response weights as well as sampling weights to make sure that the analysis is representative of the overall sample. So, right, what in particular, you know, we want to make sure that, you know, 17% of treatment group members didn't respond. We want to make sure that we're kind of reweighting those 83% who did respond to look like the overall sample population of the 100% of the treatment group enrollees. So we can use those kind of non-response weights. In California, we also only randomly sampled 2/3 of the people to have the survey because it was a much larger population. So we're going to also account for that, the sampling weight, to make sure that this analysis is representative. We do have some instances where people complete the survey but don't answer a specific question. And so in that case, we have some of this like item level non-response, and there's just not a ton that we can do about that. And it leads, you know, sometimes a few less people answer one question than another. So it changes the sample size a little bit.
Was this in person? The response rate seems really good.
Yeah, so I think there was some online, there was some phone, and there was some that I think they went in person as well. Like they have, this is where that was kind of beyond me, and I was just like hearing these updates, like that's incredible that you're able to get that many people to respond. But I think there was like some in-person follow-up. And right, some of this, especially for the 5-year survey, as I'll show you, like this was done during COVID as well. And so I think then maybe if they weren't like going and knocking on people's doors, but they still managed to get really high, like track people down and get response.
Did the initial letter come from Social Security? Or did it come from Mathematica?
I don't remember.
That might have
Right.
an influence.
I can answer that. At least for the 18-month survey, that when we did it, yeah, it came from Social Security.
Okay, so when you look at, right, we have this randomized controlled trial. So we're gonna have baseline balance. On average, these groups are pretty much identical across a wide range of outcomes. So we can look at youth sex, we can look at their age and enrollment, where do they live? In the survey, we asked about their race and ethnicity, their primary disability diagnosis. So you can see, right, about 80% of the sample has either intellectual or developmental disability or some other mental impairment. But this stuff is all balanced between the treatment and control group, as well as on a bunch of like measures of earnings, things of that nature. And something that actually stood out to me that I think is notable is that when we can even compare the people who enrolled to the non-enrollees who were eligible for the sample but didn't enroll. And now you see all of these p-values are 0.0, but they're actually not really that different. Like, a 1.5 percentage point difference between what share of people are female is not that big, I feel like. And even when you look at like the primary impairment, you have 81% with intellectual or developmental or other mental impairment versus 78.5. Like that's not a very big difference. So we're not going to say that there's like external validity. There's obviously various motivations that people have for why they enrolled, but there's not that big of a difference in terms of the enrollees and the non-enrollees. So I think that's worth just quickly pointing out. And so because we have a randomized control trial, the analysis is quite simple. We're basically just comparing difference in means between those in the treatment group and those in the control group. So it's a very simple regression, right? We have this outcome that's gonna be, our earnings measure, SSI benefits, Medicaid, and then we're gonna regress it on an indicator for treatment. So we're getting that conditional difference in conditional average difference, and controlling for a bunch of covariates. So that's not important that we do, like you get the same results if we don't control for the covariates. And that's kind of it. And so we do some multiple hypothesis testing because we have a bunch of different, we're doing a bunch of different outcomes, especially with how many things there were in the survey. The results I'll show you there, I think a bunch of the outcomes, the p-value when we do the multiple hypothesis testing is like 0.11 instead of significant. So I'm going to say that it's still significant if you don't, it's close enough that like the multiple hypothesis testing doesn't really make all of this go away. It's the same basic idea. And I'm not really going to show you, we did a bunch of different subgroup impact estimates. So we thought about how old youth were when they enrolled, what's their sex, what's their primary impairment, did the parents receive SSA payments, and then the states, like the 6 different kind of programs. And ultimately we found essentially no differential effects. I will show you one subgroup table in a few minutes, but for the most part, there weren't differential effects by these things. So, when we test, is the result different if you're male versus female? The impacts are pretty much all the same, same across the different states. All right, so let's jump into the results. So first is this table that's just going to show you what's the impact on the youth service use. And so what you can see, kind of the first thing to jump out is we look at, there's kind of these 5 key transition services that I mentioned before. about 2/3 of the control group used at least one of these services. So this is, you know, a relatively service-rich environment. But we still then see a 21 percentage point impact in terms of an increase if you're assigned to the treatment group of getting this. And this is a simple yes, no. So it's also not accounting for the fact that, you know, maybe you are getting, you know, some amount of employment promoting services, but now you're getting much more intensive employment promoting services. And so the things that really stand out as large impacts in particular are this increase in case management, you know, benefits counseling more than tripled. These are the ones, and there's a pretty big impact on these employment promoting services as well. But beyond just kind of these core services, the way that these programs all designed their programs was that there was also the potential for offering other services as well. So some of the programs specifically did that, but also there's just kind of spillovers into other ranges of services. So if you look at like life skills training, you know, attending a job-related training program, there's these other 4 services as well that we're thinking of as like potential spillovers. The early work experience we'll come back to a little later. There's big increases here as well. And what I'll note, right, when you see these different sample sizes, they're all roughly the same. It's just because certain people didn't answer certain questions. So we're gonna come back to the set of services a little bit later as I try to disentangle which of the services is what's driving some of the main impacts. But the big takeaway here is like Promise offered people services that led the families to then become more likely to take up services. Yeah.
You said earlier that the cost benefit kind of didn't pencil out. These services seem like they're all pretty labor intensive. I mean, almost all of these are meeting with an individual person face to face.
Right.
And spending their time.
Yeah.
That's what's driving the cost, I guess.
Yeah. Yeah. So the cost really does come from the delivery of these services, right? And what I'm going to show you also, which I think makes there's the cost benefit analysis is, I think, interesting. It's a little bit tricky to like disentangle, is especially as I'm going to show you, like a few of these services actually, not only did they not have an effect, but some of them, when we look at the mediation analysis, the effect goes in the wrong direction. So like we're offering these really costly services and they're actually so they're costly and they're lowering benefits too. So it really suggests that like some of the services maybe like they're not just ineffective, they're counterproductive. So that makes it even trickier in a way. So if you were thinking about like what's the like an interesting question would be, what is the most cost-effective way to deliver the needed services to achieve an impact? And probably there's a way to do that, but I have not quite figured out this. Yeah. Yeah.
So they're 14 to 16 when they're getting these services. How, do you have a sense of like how invested the kid is in this as opposed to the parent who signed them up for it? I mean, I'm sure I could get my 15-year-old to go to management services. Like I just
I
wonder
don't-
like
yeah.
how much that impacts, like if it's the age.
I don't think that we have a good measure of like how bought in our kids.
I was thinking of something similar, which like for the employment promoting services or something, maybe you see bigger take up among the 16-year-olds than the 14-year-olds or something.
Mm-hmm. Yeah, like is there a differential impact on these services by age? Yeah, that's an interesting question. Start to write some things down. Sorry, 5 minutes. And then you're on.
So all of these services are provided separately outside of school? Or could they leverage any, like I can think of schools, you know, that have different programs or opportunities or school social workers or different, yeah.
So it depended on how the state was delivering the services. Like in Wisconsin, the whole program was run through the Department of Vocational Rehabilitation. So I think those would not have been done in schools, but in other states, in theory, they could have been. And I don't know off the top of my head exactly how each of the different programs was doing it and if some of them did in fact go through school.
So this is like, does that come out in the cost benefit analysis at all?
Oh, because it's something that the school is already offering.
Yeah.
So in the cost benefit analysis, we're calculating the cost of it includes calculating the cost of control group services too. So it would be kind of washed out. If it's the same thing that's being offered to both, then it would come out.
I ask one other
Yeah.
clarifying question. So you had said there really weren't differences across a bunch of demographic kind of things. I didn't see race and ethnicity in there, and I'm wondering, I'm thinking about things like systemic racism in the educational system and labor market, or language services being available in.
Yeah, I think we did do the race and ethnicity, and it also didn't have a difference. Yeah.
And just one last question. So these are all, I didn't think this is followed by Michael. They're all one-to-one. It's not like a group of kids taking financial education.
They tend to be, one like directly offered to kids and their families. Yeah. So moving on to these, kind of some of the impacts. So I'll show you kind of the table and then I'll show you some graphs next. So this is kind of an overview of all of the outcomes. Then I'll show you how some of this evolved over time where we have it. So if you look at like employed in a paid job 5 years after enrollment, right? One thing that jumps out, these are still these are kids who are 19 to 20, but they're all out of school. Basically, only 42% of them have a paid job. And then being assigned to the promise treatment group had a 3 percentage point impact on that. So it's about 7% relative increase. When you look at earnings in terms of the dollar amount, like these are, again, very low income, low earnings of $4,400 in that year with an impact of $300. So that's not significant, but you can see it's on the same order of magnitude. We then look at, so I'll talk a little more about the program participation. The hope had been that this would reduce reliance on disability benefits down the road. And what we see is that there's actually an increase in whether people receive SSA payments in that 5th year. And the total payments are over these 5 years after enrollment are actually slightly going up. So sort of the opposite direction of what would have been hoped for, but I'll talk a little bit about that and a potential reason there in a few minutes. And then you can see right in the 5 years after enrollment, on average, there was a decline in these Medicaid and Medicare expenditures. Yeah, Allie.
Were you thinking about the impact of COVID on your employment numbers?
Yeah, so let me show you that. Good question. So when we look at the survey, right, the survey was done between May 2019 and August 2021 because of when, right, people enrolled from April 2014 to April 2016. So what we did is split out, sort of estimate what was the impact for people who responded to the survey before COVID? What is the impact for people who responded after, when it was like their survey response was during or after COVID? And what you can see here is like, if I look at employment, employed in a paid job, there was an 8 percentage point impact. The employment rate was 46% if you were interviewed before COVID. If you were interviewed during the pandemic, the control group mean was 41%, so a little bit less, but not, a bit less. But the impact was way smaller and it wasn't significant. And same thing if you look at like the earnings in the past year, it's a much smaller impact, even if the control group mean isn't really that different. So that, starts to maybe say, oh, was COVID really, like without COVID, would we have seen these positive impacts? But I want to be really careful here because the respondents differed in important observable ways. So I believe that the early responders are, among other things, like more likely to be white. And there's difference in terms of like how old they were, what are their primary diagnosis, that suggests that, some of these differences might just be not about COVID, but about who were the people that responded early, that enrolled early, maybe were more motivated to get into this program, and therefore took the survey early. And even if COVID hadn't happened, we would have seen the same split. And so I believe if you look at our results and look at impacts just by calendar year, when we have the administrative data, like if you look at the impacts in 2019, 2020, 2021, they don't look that different, but it's really tricky because then that's happening as kids are getting older as well. And so there's a whole bunch of things going on. So the pandemic is important, but I don't think we don't want to just say like, oh, without the pandemic, this would have been that much more successful.
So help me think about the employment outcomes. So they turn 18, whether or not they get benefits, like to me, it seems like one of the eligibility requirements is like you're not able to work. So wouldn't you mostly want to look at the impact for the group that's not getting benefits? Like instead of across all, like to me, that seems where I would expect the variation, right? And
yeah, so I think the issue is that who's not getting benefits in each of these groups could change. So let me come back to your question in like 3 minutes and try to address a little bit, but I think the issue is you don't have like an unbiased way to separate that out, as well as the earnings amount. Like it's not that you're not allowed to work at all, it's that you're not allowed to, you would not qualify if you're earning above like $15,000 of annual earnings. And right, you can see the annual earnings here on average are like 4,000. And so even if it's like 40%, even if even the people who are earning, take out half of people who aren't working at all, that's still like $8,000. It's well below the threshold of what would lead you to lose your benefits. So it's still pretty low employment activity.
Can you walk through the SSA results a little bit more? So it doesn't seem obvious to me that this is necessarily a bad thing, because these are people who have turned 18, they went through this redetermination thing. And if that's kind of like a noisy process and people get kicked off for reasons like administrative burden or something like that, then it seems like maybe some of these services are actually helping them like stay on SSI or get these benefits.
Right.
And so why do you paint it as a negative?
So yeah, I think you
Or
can
do I have the
sort of
process wrong.
Yeah, no. So I think that there is a side of it, right? That we know that kids who are losing benefits, they end up having pretty terrible outcomes in the first place. So like in that sense, remaining on benefits, if losing benefits has led, Manasi Deshpande's research showed it leads to more criminal activity. Like if people are then not losing benefits, they're remaining on, that's less criminal activity. So that's a good thing. From the fiscal perspective and like where the hypothesis was, it's like if people are working and earning money and then they're able to work and not receive benefits, then that's kind of less of a, requirement of resources and so on, more self-sufficiency. But I maybe placed a value judgment on that I shouldn't have. Let me talk about the main earnings results, then I'll show you the SSI benefits and talk a little bit about kind of, there was some programmatic stuff that's driving, I think, some of these findings that we have. So let me come back to that in like 2 minutes. Yeah.
I guess you're gonna, because I was thinking similar to Karina, I'm not sure if the positive effects are necessarily a bad thing, because, and I guess you'll get into it in a few minutes, but how you said benefits counseling was also part of the packages of services that they received. And so maybe during benefits counseling, they talked about the importance of the recertification process. So maybe some good things were communicated in that SSA wasn't necessarily expecting to be communicated.
So let me just talk about this now, because it seems like there's a lot of interest. So since before I then veer to something else and come back, we can talk about it in a slightly different order, which is, so if we look at, right, here's the impact on the receipt of SSA benefits over time. So if I'm looking this is taking everybody when they enrolled and looking kind of 1 year after, 2 years after, 3 years after, and so on. So each dot is its own separate regression here, where it's like the outcome is SSI receipt in the 1 year after you enrolled. And so we're looking at that administratively. So like if you enrolled in April of 2015, we're looking at May 2015 to April of 2016. Did you receive SSI benefits? And so in the first 3 years, treatment and control group are pretty much the same. And then we see a big increase in the 4th and the 5th year. And the 5th year is what I had showed you on that previous table. And right, so there's reasons that might be good. It could, you could make an argument of it being good or bad, but what I want to kind of, rather than place like a value judgment on that, I think what's really important is to note that I think this is almost driven by programmatic, kind of programmatic rules. Because what's happening is, so there's this thing called Section 301, which says if you lose benefits at an age 18 redetermination, or if you are going to lose benefits at an age 18 redetermination, if you are participating in certain employment-oriented services that can include like vocational rehabilitation, it can also include promise, then you can continue to receive benefit payments, even if the age 18 redetermination says you would have lost them. And so, right, if I'm looking at now the subgroup difference for people who were 14 and 15 when they enrolled versus people who were 16 when they enrolled. And so what you can see right away is like, if I look at the receipt of SSA payments in this 5th year after enrollment, for the 14 and 15-year-olds, they're now 19 and 20. They have 68% of them are getting benefits. For the 16-year-olds who are now 21, only 57% of them are getting benefits in the control group. And so what's happening is that age 18 redetermination is kind of being finalized for many of them during this period. Because if you have your benefits ceased, you can appeal that determination. And at this point, that's more likely to be done by the time you're 21 than by the time you're 19. But what's really notable is that for these 14 and 15-year-olds where they're kind of still maybe going through the age 18 redetermination, there's no impact of being assigned to the treatment group. All of the reason that we see that increase in the 5th year after enrollment is because of the 16-year-olds who are now 21. And so they're the ones where the treatment group, they went through the age 18 redetermination. Arguably, they then, because they're in the treatment group, can say, hey, I get the Section 301 thing, I'd like to keep my benefits. And so then they become more likely to keep their benefits. So it's not like the program is, I would say, it's not that the program is like increasing dependence. It's that programmatically, it's helping them to remain on benefits. And so the question will sort of become, what happens a few years down the road, which is a pretty lame, analysis for here we are 5 years after, but I need more time. But that's what we have.
Are you able to directly observe the age 18 benefits reassessment and see if the rates differ for people?
Yeah, so I think that we were not able to get access to that data specifically, but it would be helpful if we were. Yeah, so it's something that I could imagine maybe doing in the future. Okay, but you can see, right? I mean, otherwise, some of these age patterns, like when you look at earnings, the earnings are higher for the older kids as they're a year older now, but there's not a differential impact. Like we still see just a consistent positive, but fairly low, low precision basically.
So you said there's a few cases where somebody got SSDI, which means they got enough quarters of work to qualify for SSDI, but their benefit's much larger than it would have been an SSI.
Their SSDI benefit is?
Yeah.
I'm not sure if that's actually, because they have such a low earnings.
The benefit level
rate.
might not be enough.
Yeah, and I think some of that could come from like their parents basically, or where there's like, right, an SSDI benefit isn't necessarily them getting it based on their own
qualify on
work.
their
They might qualify on their parents' record, but it's a really small percentage of people.
Okay.
So like when you look at, yeah, I guess this is SSA payments. I'm not specifically showing SSI here, but this is pretty much all SSI. There's very few people that get SSI. All right. Okay. And just a note on this, right? We see with the SSA payments over time, now this jumps in the 3rd year, but kind of the same basics. Okay. Let me go back and then talk about employment story. So now, right, same picture, each dot is its own outcome. So now we're looking at now we're using the administrative data on calendar year. What's the calendar year after you enrolled? 2 calendar years after you enrolled, up until 5 calendar years after. And what you can see is, right, so I'm just looking at the impact. Now I can't show you the control group mean as easily. But there's a huge impact in the first year after enrollment. But a lot of that is because what the treatment was doing was, for some instances, giving people paid jobs. And so by giving them a paid job, they're more likely to have paid jobs. By the time we get to 5 years out, like, that's not the driving force anymore. So we see that this impact is really shrinking over time, and like the control group mean here is very low. Here it's gotten quite a bit higher. So especially as a relative percentage, this is changing, but you still see something positive and marginally significant 5 years down the road. And when we look at the dollar amount of earnings, the picture looks a little bit different, but in relative terms, it's actually essentially the same. So this impact of $200 1 year after enrollment, you can see, I mean, much narrower standard errors because the control group mean is so low. That this is like a 56% increase in their earnings. And then as time goes on, even though we have like a higher dollar amount in year 5, this represents something like a 5 or 6% relative increase compared to what the control group was earning 5 years out. So, you know, we see improvements in earnings, but that's fading over, and employment, but that's fading over time. And then when we go to Medicaid and Medicare participation, this is pretty much all Medicaid, kind of for the same reasons everything's about SSI. But you can see there's no difference. Being assigned to the treatment group doesn't really affect whether or not you have Medicaid. Pretty much all of these kids are covered by Medicaid. But when we look at the expenditures, the average monthly expenditures over time. So I showed you that on average over the 5 years, this went down, but that's really going down because of what's happening over time. That by the time we get to the 5th year out, there's this $50, monthly reduction that's significant at the 5% level. And so, it means that we are spending less on kids' health care. Yeah, Karina.
Going back to, I think it was Hillary's comment about the employment and like how it would be nice to have like an employment result for people who maybe are getting kicked off of SSI and not for the ones who are just going to be on benefits for who are extremely disabled. Do you have good disability measures, like what their disability is and stuff like that?
We have their primary diagnosis, but we don't have a way to measure their severity.
So you couldn't do, what I was thinking of was like, could you do some kind of prediction model of whether they're going to be on SSI after age 18? And that's powerful enough, you could break it down into effects for the group that like you might expect some employment effects and where you wouldn't.
Yeah, and I guess as you're saying that, one thing that would be interesting to explore, I have to think if we can do it with this data, but the one thing that we could potentially say for severity, and I don't know if it's there in the right data systems, is like people get assigned to a medical diary of like, when are you, based on when you first enroll, when you're going to be up for potentially redetermination of like, did your health condition improve? And how often that happens. It either happens within like 6 months to a year, 3 to 5 years, or 1.5 to 3 years, or like 5+ years. That could be a way to do this. Almost all of the kids are in that like intermediate group. So I think 70% are in, it's medical improvement is either expected, possible, or not expected, and like 70% are in the possible group. But it would still be something. The challenge might be if some of these kids are enrolled recently, if you enroll near your 18th birthday, you might just automatically get placed into a group because they don't really do redeterminations as you're getting right up to 18. Did you have a question as well?
I have a much easier question. It's just like, can you give us a sense what the baseline need is for the Medicaid expense? So it's like $600 a year. You scale up the $50 a month estimate. It's pretty big, but I wonder how significant.
Yeah, so when we look at the average monthly expenditures, over the 5 years, I don't think this changed that much, but it's like 1,100 a month. So that's right, $13,000 a year. And so, right, this is not nothing, the $50, but it's not massive. 5-ish. Yeah.
Again, like scaled by the people who, like the people who are not gonna leave, maybe,
Right.
tell me if I'm like going down the wrong track, but the people who are not gonna leave SSI, you're probably not gonna see a difference here because they're gonna continue to be on Medicaid.
Right.
And so the treatment effect is really among the group that's on the margin of getting kicked off, I think. So could you, if you
Yeah.
scaled it by that and it's like half the population or something, then it's a double the size of it.
Maybe bigger, yeah. And also, I mean, I would think especially on this outcome, like what the baseline mean is for the people who are never gonna get off SSI, like they presumably use much more intensive
Yes.
healthcare
Yeah.
than the people who might get off. Yeah, it's good. Okay, so just in terms of summarizing these main impact results, right, we saw that there's this improvement in employment and earnings, but it got smaller and it fades. Lower healthcare expenditures with that growing over time, and then this higher receipt of SSA payments. But right, how we want to think about that, it is potentially because of these programs. So let me now spend a bit of time talking about this mediation. The idea of what we're trying to do with the mediation analysis is we're trying to decompose the total impact of promise on, say, someone's earnings or on their employment into what's the indirect effect operating through mediators. So it's like promise impacted whether people got benefits counseling, and then benefits counseling has an effect on people's employment. And we're gonna have 9 different mediators versus what we'll call the direct or unattributed effect, which is just like, for whatever reason, you're assigned to promise. And the things that we can account for, we've accounted for everything, just kind of like, what is the assignment itself doing to your employment? In theory, right, if we've captured everything, there's no reason that like happening to be in a treatment group should have an effect on some of these outcomes. So it should, probably a lot of it's going to be operating through these indirect channels, these mediators. And so the 9 mediators that we're going to consider are the 5 key services that I showed you, as well as the 4 other service-based metrics that are potentially spilled over. So is what I showed you in that table. And then we'll think about 5 main outcomes that are all measured in that last year after enrollment. So we're gonna look at the employment, earnings, whether you got any SSA payments, the total SSA payment amount, and your total income. So the way that, in order to do this mediation analysis, we're gonna have to make a few assumptions. So first, we need to assume that there's no confounders between treatment and the outcome or the treatment and the mediator. That is a really easy assumption to prove because we have random assignments. So everything is random in terms of the confounding between treatment and something else. Second, we have to have no confounders between the mediator and the outcome. And this one is probably the toughest assumption to prove. I would love more thoughts on this. We did get some comments from a referee that they were a little bit concerned about this assumption in particular. We kind of point to is there's this paper that shows if the mediator is measured shortly after the treatment occurred, then maybe you don't need to be too worried about it. We're measuring this, these mediators 15 months after kids enrolled. We're looking at these outcomes 5 years later. So maybe that's close. So it'd be great to maybe make that argument a little bit stronger. And then lastly, each mediator is measured accurately. Hopefully that is true if we've defined a careful survey with Molly's help. And then, so what we have in the sample for this analysis is 8,056 youth. So it's 77% of the eligible group. If you remember, we didn't sample part of the people in California. And so it's of the people who completed both of these surveys, right? They had to complete both the 18-month survey to tell us about were they using these services that are the mediators we're interested in, and then also do we have their outcome measures. And so we lose, right, 23%, 21% of that is at least, they didn't respond to at least one of the 2 surveys. And then in some instances, people didn't respond to all of the questions in the survey. So we lost another 2% of people that way. Okay, So to do this analysis, what we're essentially doing is two regressions. First, we're gonna regress the mediator, which is just the use of a service. So like, did you get benefits counseling on the treatment? And so we're then gonna say like, what's the impact of treatment on the receipt of benefits counseling? Then we're gonna regress the outcome on the treatment, as well as all of these 9 mediators, all of these 9 services. And so, right, we're now kind of controlling for whether or not you got that service. And so the direct effect, the things that we can account for, is just that beta 2, like what's the effect of treatment after I've controlled for all of these other mediators. And then when we think about the indirect effects of each service, you're just multiplying the relevant coefficients. So it's I multiply this treatment use of like the use of service regression, like what's the impact of treatment on the use of benefits counseling on the coefficient associated with benefits counseling. And then, you know, with financial education, I have a separate regression, and then I have another Greek letter for what's next, and you have that for all 9 of these. Yeah.
So each service has its own sort of independent effect. But what if I do multiple services? Like what if they interact with each other? Like,
Right, so in theory, you're sort of relying on the fact that there's variation in terms of, it's not like, you're relying on variation of the take up of services across people, and that like some people took up benefits counseling and the parent training and information. Some people took up case management and benefits counseling. And so this is definitely, we need to pool here to make sure that we have enough people and hopefully enough variation that it lets us get at this independent effect. But certainly, right, it's possible that there could be multiplicative effects where like getting 2 of them together is really what's driving this. And I don't think that we can really account for that. That would probably start to fall into that direct effect.
this is more, would you think about this as like a lower bound of each of these individual?
I'm not sure. I'd have to think about if it's, because you could also imagine it. I don't think it has to be that the multiplicative effect is positive. Like you could have both of them, you know, you get both these services and you get some competing information. You just like throw your hands up and, or like, I give up. So I'm not sure if I want to like place a sign on the bias, and ultimately, right, this analysis is less rigorous because there's more assumptions. You don't have the nice random nature, but it's at least hopefully getting something informative. Okay. So I didn't put this table it's even wider in the paper, but I didn't want to I included most of the services, but not all of them here. So what I want to just show you is like the early work experience is, I think, the biggest driver. So here's the total effect, right? And you can see that like, if I look at employed in a paid job, if I have this early work experience, there's then a 3.1 percentage point increase of that early work experience on employment, which is like all of the total effect. When I look at earnings, it's more than 100% of the total effect is coming from the early work experience. When we look at kind of the receipt of SSA payments, these become negative, right? Because you're now working more, that's leading you to kind of potentially get off of benefits. But even though that's going down on net, we're seeing an increase in their total income when I think about their earnings from work and their benefit payments. So it's really suggesting that early work experience is kind of what you can think of as like, what was the initial goal, the hypothesis that these policymakers had. To a lesser extent, we see the help learning about or getting into school or training. It's like the same direction, smaller sign, but positive effects on employment and earnings, negative effects on SSI, and positive on income. When I look at these like 5 main services that were kind of the core services that were the driver of this program, they don't always go in the right direction. So if we look at like parent training or information, when we give parents more information, we see that it looks like these services are actually leading kids to earn less. They're more likely to remain on SSI benefits. You know, especially case management, that's especially leading to an increase of like $508 in the total SSA payment amount, and a 1.6% increase in receiving SSA payments. And so maybe kind of the case management is helping people know, you know, oh, there's the Section 301 thing. that you might want to try to remain on, that you can, as a result of being in the treatment group, remain on benefits. If you learn about that through your case manager, but if you weren't getting case management, you don't know about that provision, right? I could tell a story where that's kind of partly what's driving this here. So there's a lot going on, but I think, you know, as I alluded to earlier, that like, as I think about this cost benefit analysis, like some of these are really actively working against us finding a positive net benefit, but they're still costing a ton of money because it's personal interfacing with beneficiaries. And it really is what's leading to these positive effects appears to be the early work experience, and to some extent, learning about getting into school and training. Okay. All right. So to wrap up, we see that these key services that we offered, they improved employment and earnings, they reduced health expenditures. It's small and fading to some extent, especially on the employment side. But given there's such challenges in transitioning into adulthood for these youth, I think it's still pretty notable findings. The mediation analysis does suggest that early paid work experiences are important, and I think that's consistent with some of the literature that we have about helping disadvantaged youth. So like Sarah Heller has a bunch of papers about these like summer job programs as being really beneficial, and this is sort of exactly in line with this. There's been a lot of other research on Promise, so I don't have time to talk about all that, but like people at Wisconsin Promise have done a bunch of papers, and people at other of these Promise programs did a lot of work, often really focusing on the implementation. There's a whole 2019 special volume of the Journal of Vocational Rehabilitation. But I think, you know, to some extent, what we're doing with kind of being able to look at the whole program, all the impacts, like that was kind of the initial fundamental goal. And so I think thus far we're offering the definitive assessment of like what was a huge effort with millions of dollars spent by SSA, Department of Ed, and so on. So when we think about this benefit cost analysis, what we do is we're thinking about kind of the youth and families, the government, and then all of these stakeholders combined. So you could think about like for benefit payments, for example, right? If youth and families get more money in benefits, that's a net positive for them because now they're getting more money in their pockets at the end of the day. The government is spending that money. So that's a negative for the government. But when I combine it, it's sort of going to even out. Not exactly because there's like the administrative cost of delivering those payments, but roughly you can think of that as netting out. So we're going to look at what were people's earnings, what were the taxes that they paid, because if you earn more, that means you're paying more in taxes to the government. What was the cost of these benefit payments? We have some stuff about costs of incarceration and education. That was other stuff that we collected through the survey. And we're going to draw on the impact analysis as well as then to think about the benefits on most of these outcomes. And when we think about the cost, there was a lot of effort done earlier in the project to collect the cost of everything. So that included looking at financial documents, doing interviews with staff, reviewing staff activity logs, and so on. Yeah.
You look at receipt of other public benefits?
Yes. And so, right, as all of this stuff happened, right, the timing is all varying. So we adjust for differential timing by converting everything to $2020, and then we have a discount rate to filter all this stuff through. And ultimately what we find is kind of the takeaway number is that the net benefit is negative $25,000 per family was the cost of delivering all these services. It's really costly to have this benefit for youth and families. The net benefit was $2,150. So, right, 10 times more cost than we have. And this is the net benefit, so it's accounting for the $2,000 benefit. So much higher cost than benefit. The biggest cost, though, is administering the intervention, right? And so doing all of these services was what was costly. And again, we're looking at when kids are 19 to 21. They're then, you know, in theory, these benefits are going to accumulate for years and years. And if the earnings and health expenditure impacts persist, like over time, that calculation is really going to change. So I think it's a mistake to say, look, this cost was so high because we don't yet know the full benefits. But it's also a mistake to just say, look, we improved some outcomes, so everything's dandy. Like this was really expensive. And how we want to weigh this is, you know, there's sort of more to learn as time goes on. Yeah.
They're almost all labor costs though. I mean, it's a lot of hours of salary wage time. I mean, that's potentially something, if you went to a bigger scale or technology, like you could drive that cost down, maybe.
Used existing
Yeah,
services.
I mean, this was at a relatively big scale, like it was, like there were 2,000 people per program. I mean, that's not serving everybody, but like, if you look at that, table that I showed of like the enrollees and the non-enrollees, like I think about 10% of the eligible people, or no, maybe it's even more, but like a fairly high percent of people who are eligible enrolled. Like it's not 2%, 1%, like we've had in some other demonstration. But yes, as you get more to scale, maybe things get more efficient.
It makes me wonder if just giving families whatever the net cost was would maybe result in better outcomes. One thing I wanted to point out on like where you have your control means is that the earnings are still very low. Like you were showing $5,000, $6,000 as like the mean earnings, and that's annually, right? And so even if someone gets the max SSI benefit, that's a little less than 12,000 annually. So like the benefit of being on SSI, like relative to the average earnings, is still much greater, like to the individual.
Right.
And so I guess like I'm struggling with like what it, kind of going back to that just Fonda paper we talked about, is like, what is even the point of pursuing the labor market at the expense of SSI if it's not going to recoup SSI costs, like, you know?
Yeah, I mean, it's an important question, right? I think probably there are some where, right, we're blending a bunch of people who have zero earnings and, you know, on average people who have like $4,000 or $5,000 of earnings. Even given that, right, like, yeah, probably for a lot of people, it doesn't make sense, but there are some where the earnings are a bit higher, and, you know, but then as you start to think about the overall population, that's a relatively small percentage of this group. And so, you know, how do we think about all that? It's tricky thing to ponder.
Working might have other value too.
What, yeah,
I mean, there might be.
right.
And do you know how much of the cost is the employment services as opposed to the case management service? Because if they had the bigger impact.
Right, I don't know that, but it's worth trying to tease that out a little bit. Yeah.
Any specific like requirements to like qualifying for promise other than like being on SSI? Cause I'm thinking maybe there was some kids who might be more, you know, able to work and they tend to participate in employment services more versus others who have like severe disabilities who tend to participate in case management or like getting benefits more. So they're not really experiencing that increase in income like the other group.
Yeah, so there was not, I don't think there were other criteria beyond being on SSI, but just going back to this table that I showed you a little earlier, right? If you now, for some of these earnings stuff, we're looking at earnings in the year that they turn 18. So we're looking at kind of who enrolled and who didn't. And this is just comparing the non-enrollees to the control group. But like, I mean, $1,300, so one, really low, but it's not like the people who are enrolling are so much more like work-oriented, work-motivated, right? They're roughly the same, with roughly the same earnings, a little more likely to have any earnings. Like 39 versus 35 and a half, I don't think it was like a huge difference, even if it's very clearly significant. So it's possible, but I don't feel like that's what's driving it, but it's certainly story one good job.
Probably should call it there. So join me in thanking Mike for his time.